for joining us. It is 3 o'clock, so we will make a start. May I first of all ask for apologies for absence, which I believe come from Paul Bentley. But Vincent Badu, you are standing in his stead, so you are representing the ICB, which is good. Phil Thorne, Health Watch Medway. No, we haven't got those here yet. Martin Riley is off. Sorry, beg your pardon. Phil Thorne sends his apologies. Martin Riley sends his apology, as does Leanne Farrar. And but of course, we are very pleased to welcome Coach Black and also Jackie Brown with us here today. So thank you for that. On our invitee side, Adrian Richardson, Director of Partnership and Transformation, and Dr. Caroline Rickard, the Local Medical Committee. They've also sent their apologies. Item 2 is a record of the meeting held on the 9th of February. Is that correct? Is everybody happy with that as minutes? Thank you. I'll sign those. There are no urgent matters. And item 4 is declaration of disclosable pecuniary interests and other significant interests. Are there any interests to be declared by anyone in the room, please? Good, thank you. Now on to the main business of the meeting. As usual, may I ask those introducing the reports to keep their introductions to a maximum of 5 minutes, please. So the next item on the agenda is the Kent and Medway Draft Joint Forward Plan, to be found on pages 15 to 96 of your agendas. And we now move to, could I ask Vincent if he would present this plan, please? Thank you.
Thank you very much, Chair. And I'm joined by my colleague Rachel Hewitt, who's the Director of System Strategy in NHS Kent and Medway, who's led on some of the work in relation to development of the plan. So this plan's brought to the Health and Wellbeing Committee as a consultation on the development of a 5-year plan for the NHS across Kent and Medway to really set out how we will deliver on the integrated care strategy, the interim integrated care strategy, which was approved in January of this year. So the integrated care strategy for Kent and Medway sets out 6 shared outcomes which we want to work together on collaboratively across Kent and Medway, really with a focus on reducing health inequalities across our populations, but also having a really strong focus on prevention and tackling the wider determinants of health. So it's nationally required for NHS systems to develop a joint forward plan. The plan is very much been developed in partnership with the NHS providers across Kent and Medway. I know colleagues from the Medway system are also here with us today. So again, this plan is a plan that we've developed really to look at the key elements of the shared outcomes which we will contribute towards delivering on, but it will not cover all of the shared outcomes in detail because of course we'll want to work with partners in the local system and input into the local health and wellbeing plan, which I know is being refreshed at this point for the Medway population to ensure that actually collectively we can deliver on that ambition for integrated care across our system. So the guidance for development of joint forward plans is quite permissive in terms of the areas of focus that we're asked to look at. And we've worked with partners to interpret those, but also to ensure that the plan that we're putting forward also reflects really clearly the operational planning priorities that we've set for the NHS across Kent and Medway in year 1, which is 2023-24, that begins in April this year, and then flows into year 2, which is from 2024 to 2025. The plans that we have articulated in the draft for years 3 to 5, we anticipate there'll be some change around because we're not at this point able to work with absolute certainty on where there may be a need to either flex priorities or to revisit priorities in line with national guidance and national requirements. So really we're coming to the Health and Wellbeing Board to have a discussion together about how we develop this plan. We've set out some key questions where we would like your support in the consultation to identify whether this plan reflects the priorities for the Medway population in terms of those health inputs, whether there are any areas where there are significant emissions or that we may want to go further or think about in more detail, but importantly, thinking about the focus of this plan is around inequalities and the wider determinants. It's not anticipated as a plan that will be looking at or overtaking some of the strategies that we already have in place. And I know that one of the things that is really important for the Medway population, as it is for other populations across the system, is how do we address some of the challenges that we have here and now. And I would want to just point out to the committee that actually there are other strategies, such as our primary care improvement strategy, that will provide more detail around the actions that we're taking in those areas. And so happy to pick up those questions, but we may need to refer back to those plans and bring more assurance around delivery on those plans to a future meeting.
Thank you, Vincent. Any member, please. Adrian?
Thank you, David, and thank you, Vincent. I certainly welcome the opportunity to for more closer cooperation between the council and health, because one thing I've learned over the last few years that no one agency has more than a fraction of the answers to dealing with some of our more difficult challenges. There's so many things interlaced. So I really well, and I think already as a council we've got a good track record of working. Some of the projects, I must admit, have not been easy. We have still not resolved the Chatham Healthy Living Centre issues, and I have to say that had the Pembroke Centre been in private ownership, the rug would have been pulled under this project a long, long time ago. We have been exceptionally patient, and you now have to take in regard it's also costing us as a council and the council taxpayers of Medway a lot of money to keep that space vacant for the health service, hopefully, to step in. And I'm not talking about small sums of money, I'm talking about hundreds of thousands of pounds it will cost the residents of Medway. So yeah, we need to get forward with that. But there's other good things we've done. I mean, the project we did with KMPT for the Britton Farm facility, that has been a really brilliant example of joint working together with huge benefits. It's contributed to the regeneration of Gillingham, because the health professionals and the clients that go there, it's increased footfall into Gillingham town centre, and by doing a reasonable deal that was beneficial on both sides, the council and hence the residents of Medway are enjoying an income from that facility, which has helped subsidise our other council facilities. So that really is a win-win. We've worked in the past with one public estate projects. Look forward to the opportunity to do that again, and also with Medway Hospital. I think there's some opportunities there to work together. Particularly, we have the opportunity of a district heating system in the central part of Medway in Chatham and Gillingham, and by far the biggest potential user of that is Medway Hospital. They're the biggest energy consumer for going in Medway. So there's some really, really good stuff to work together with there. Vincent, you mentioned GP services, which is outcome 4, isn't it? We've really got a challenge there. I'm not exaggerating. Having spent the last few weeks involved in electoral activism, talking to people in Walderslade and Lordswood, I can tell you that in that area, the lack of access to GP services is just as much a talking point as our potholes. It is a real issue. You know, when I say it's on the par with potholes, that shows how serious it is and how strong the feeling is in that area that they're not getting the GP access that they believe they need. So we've got a real challenge with them. Also with outcome 5, I noticed there was talk there of centres of excellence. I fully get that we need full centres of excellence because you need a certain level of population in order, you know, to get the expertise and finesse, which is into several hundred thousand, which is much greater than indeed our Medway or indeed our Medway and Swale population. But it does concern me that we don't seem to be allocating any centre of excellence into Medway Hospital, or perhaps have I missed something? And it would be really good that Medway Hospital could become a centre of excellence, because all I've seen over the last few years is services being withdrawn from Medway Hospital. You know, it's not been regarded as a centre of excellence. At one time it was regarded very much, and there was anecdotal evidence that when somebody had a stroke, that the ambulance service would out of preference take them to Medway rather than anywhere else, because they knew the outcomes from Medway for stroke victims would be very good. But we've lost the stroke service. I couldn't help but notice also there was mentioning there a £460 million investment for East Kent. I don't for one moment say that it's not a good thing to do and not necessary, but it does put into stark reality that Medway Hospital doesn't seem to be getting much in the way of investment, and that's a great shame. But so that's a mixture, isn't it? A few gripes in there, but also the positive thing is, I think as a local authority, we are keen to work all together. There's a lot of goodwill, and I think we've shown that goodwill over the Healthy Living Centre project in Chatham. You know, we still want to make that work. We're bending over backwards to make it work. There's a lot of goodwill in the authority. You know, we want good and better health outcomes for our residents. You know, we have still got too big a life gap, haven't we, between our more prosperous and our less prosperous areas. We've got to do our level best to close that gap. You know, so yeah, I'm up for it. Thank you.
Did you want to come back on that, Vincent, or would you
Sorry.
prefer other people to speak and then...
Well, I'll just make a few comments, but I'm sure colleagues such as Jane will want to comment as well. But firstly, thank you for the comments and about the draft joint forward plan. We acknowledge absolutely that this is a plan around how we work together. It can't solely be delivered just by the NHS, and when we were waiting for the guidance around having a forward plan and working together with council colleagues and other partners in the local system, we were hopeful that it might be a joint forward plan for the system, because actually what you want to see is how the system is working together collectively to address some of these issues, but also to ensure that there's a stronger focus around well-being and prevention. And I think that's absolutely what we've been contributing towards the work we're doing here as a board. So I just wanted to add a couple of things, that particularly your points around development of our estate, and particularly you referenced the healthy living centres. And I know that you're aware that from the NHS Kent and Medway point of view, we're absolutely committed to working with local partners to ensure that we've got the right estate and the right capacity available at a local level, but we will need to do that in a way that ensures that it's affordable, but also that we make best use of the other resources and capacity that's available. And again, I think that's why we need to take stock of where are the other healthy living centres across the patch, how are we utilising those, and how do we make best use of that estate. But notwithstanding that, I think one of the other challenges for the whole system is around workforce. And we've been working really hard as a system to support our primary care colleagues to think about how we can both recruit, attract, recruit and retain the right workforce to serve the local population. And again, I think partners in the council have a key role to play there in terms of how we really do attract and sustain people to relocate or to locate themselves in Medway as an area. We've seen some significant progress through the GP attraction programme in attracting GPs to live in Kent and Medway, and after their training within Kent and Medway to stay in Kent and Medway. But again, a key factor to ensuring that that's possible is about that access to affordable housing as well. And I think that's one of the areas where we need to work really closely together between health services and local government and other partners to ensure that we can move that forward. So again, that's just one example that I would put in as an area that we want to see focus on. Finally, I would also want to just emphasise some of the work that's already going on in Medway through the Health and Care Partnership as well. And there are a range of programmes that we've seen that are around actually working together with colleagues in public health to ensure that we're targeting the right parts of our population, and that we're working together around those areas where there are significant disparities, and in particular the work around supporting people who may need more support around healthy weight, or people who may need support around obesity or diabetes are really good examples of where we want to focus our attention to really enable us to stop that escalation in people's health conditions to a point where they may need to come into contact with secondary healthcare services. So again, a significant element of our plan is around how we increase our focus and inevitably our investment in that area around prevention as well. So I just want to add those points alongside the feedback that you've given as well. Thank you.
Yes, thank you. Just to add some points really to Councillor Galvin's points. Certainly there's a number of things for us at Medway. We're just embarked and nearly finished the first stage of our clinical strategy. So that's looking at all of our services, and that, we want to share that with people. We have done quite a number of sessions with stakeholders, both internally and externally, and users of our services. But recognising that we do have pockets of excellence. We've got neonatal services, we've got robotic surgery, and actually we want to develop those services in line with very much that what's in this integrated care strategy around making sure we provide local access for our patients. So really important that we recognise what we've got, but then develop that further. So I'd welcome the opportunity at some point to share that clinical strategy with you and be able to do that. So I think that's great. I think picking up the Healthy Living Centres, actually, working with the Health and Care Partnership, we've got an opportunity to really look at how we can deliver those services even more locally than just at Medway Hospital. And so we are working across the board as that Health and Care Partnership to see how we can facilitate some of that. So that's quite exciting, and I think that will improve access for our patients as well. I think there's just a couple of things for me, really, just in terms of Vincent. We really welcome this strategy, and actually even with not only my Medway FT hat on, but also from the Health and Care Partnership, you can see the priorities that we've agreed actually do align a lot to this, and that's really important. But I've got a couple of questions, really. It's about, as we go forward, not only as a health and care partnership, but also as a health and wellbeing board, how can we contribute and to develop the plan? So what's the next steps and how can we do that? And I think the second bit is then, so how will we then at this board see the delivery, and how can we then, you know, make sure that we are contributing to it? And it's about monitoring that really and seeing how we can then go forward. So there's a couple of questions there for you, Vincent.
Thanks, Jane. And again, really welcome your support and the support both of the Acute Trust but also the Health and Care Partnership, because this is very much a piece around how we work as an integrated care system as opposed to just one or other provider. So really welcome that. I think in terms of developing the plan, this is the draft of the plan which we're seeking feedback on, and absolutely want to iterate it with input from colleagues such as clinical leaders as well, because they're key to making sure that we can deliver this, we can translate it into reality, but also inform other parts of the system that we're connecting with. And importantly, capture the difference it's making, because this is about improving the outcomes for people and patients, and actually we need to make sure that it's well socialised. This draft will be iterated further as we get feedback from the consultation engagement, both with health and wellbeing boards, but also with the sovereign boards of provider trusts. And it's scheduled to go to the boards of both MFT, but also to the board of Medway Community Health. And we have also sought to get engagement from other community providers in Medway, recognising that there's a mixed economy and there are others who feed into how we deliver those services. A key focus in terms of how we get ownership of this board and this plan and drive it forward is that alongside it being approved by the Integrated Care Board, it will also go through our Integrated Care Partnership, which is our joint committee across the integrated care system, where we are all represented as stakeholders through those different partnerships. So health and care partnerships are represented, our individual local authorities, both at upper tier level, but also our districts and boroughs, and then also our key delivery partners across the voluntary sector as well are represented. So that particular board will have oversight of the delivery of the joint forward plan, but also within the ICB we've established a Inequalities Prevention and Population Health Committee, which has 3 specific subcommittees, one that focuses on inequalities, one that focuses on prevention, and one that focuses on population health, and how we use the population health management programme to really help us to drill down on the development of those interventions that are going to help us manage the health of our population, but also improve on the outcomes that we see being generated through work at a neighbourhood and locality level. So again, what we want to do is make sure that through those subgroups, which are jointly chaired by myself and the 2 directors of public health, actually feed back into the work that we're doing both through this plan and the local joint health and wellbeing plans that are being developed now. So again, I think for the Medway system, it would be really key that through this board, we're feeding into the local joint health and wellbeing plan and using that as the vehicle to monitor delivery both on this plan and other work that's going on across the local system. So that would be the point that I would make. Again, I think our participation in this Health and Wellbeing Board is also crucial to make sure that where there are knowledge and information that will help us inform how we take forward these priorities, that we're sharing that together. So that element around the local intelligence is equally really important. And that's where, for me as an example, really welcome the feedback from elected members who are in contact with people on the ground around both their experiences, but also their learning around where we've got some of the changes right, where there are others that we could go faster on, and other opportunities to think in a different way. So again, just using those spaces as a vehicle to help us both maintain oversight of delivery, but also inform the development of the plan. And then finally, I would say that we are going to refresh our plan on an annual basis. That will enable us to make sure that it's linked into the operational planning cycles for the NHS. So again, that gives us the flexibility to ensure that actually we can alter our focus if the needs of our population changes, or if there are other areas of priority that we feel we need a greater or stronger focus on. So I hope that kind of gives you a sense of how we will take that forward.
Vincent. Could James come in?
Yeah, of course.
And then you.
Thanks, Chair. And Vincent, you actually did talk to a couple of the points that I was going to flag in relation to that broader piece and the way in which actually we're trying to ensure that this delivery plan actually enables and facilitates the other work that you referenced and you went to. There's just 2 points I wanted to flag. So one was around the innovation and the centre of excellence, and I do want to put Jackie on the spot, if I might. And it is because of the way in which we've been working collaboratively, particularly with our acute colleagues, to manage hospital discharges. And I think members will be aware, and this board, prior to the issues around the COVID-19 pandemic, we had one of the best processes and systems to actually support people to be removed from hospital if they didn't need to be there and placed in whether back in their own home or in another place where they could feel safe and be supported. But Jackie, I just want to pass to you, because I know we've been asked about how we do that work now, and even though post-pandemic and other areas are looking to come in, and it just talks to the stuff that Jane was talking about there are lots of things that we do, and some of that we'll unpick in our development session a little bit later on, but there are live examples that we've got around innovation, even though it might not appear to be the case. Jackie.
Thanks, James. I like being put on the spot. I suppose we go back to what James was saying was prior to COVID, Medway Council working with MCH and MFT were a centre of excellence with hospital discharge. When COVID funding ended, that meant that we had to shift the way that we work. And from an adult social care perspective, and it does have an impact on MFT, we've had to rethink about how we assess people before they are discharged from hospital. And that's not really the way that we want to be, but we have to do that because of the funding challenges. I'm really pleased to see on a daily basis that assessment process doesn't have an impact on the hospital discharge. What the impact is the availability in the care market for us to move people out of hospital. So from an innovation point of view, that was turned around very quickly, and MFT, MCH and Medway Council worked together in a space of a week to put that in place and get it up and running. Saying that, we do want to move back to the previous model. We want to create a community discharge hub, and that'll be something else that we'll be working on together. Jane will be leading, but we'll all be working with her. The reason that James mentions that is we've been contacted by another local authority who is having to consider moving to the way of working that we are at the moment. And because they know that our assessments are not causing delays, they actually want to come down to the hospital and meet the team and talk through what we're doing, so that if they have to go down the same route as we do, that it doesn't have any implications for patients. But I will reiterate, we do want to go back to the previous way of working.
Well, thank you very much for this report. I think obviously, there's an awful lot of work gone into it and some very good ideas here. But one or two things I'd like to sort of put into the pot, if I may. First of all, I think on the GPs, I mean, obviously, primary care, we must do all we can, as it says in the plan, to attract new GPs to the area and also for their support staff. As same sort of problems we have with our social workers as well. I think this whole sector is difficult. I personally think that we're not doing enough in housing, generally. I don't think the government's quite got the message about how one can offer tied housing to numbers of different people. It will enable them to settle in the area because, quite frankly, once they're there, it's a bit painful to move. So, it gives them an added stake in the area, if I may put it that way. So I think it's the first thing. The second thing is that we know there are a lot of doctors retiring. We know that you know, one may or may not be successful. I certainly think it'll be partly successful in getting new GPs into the area. But the thing that the plan didn't seem to me cover very well was, well, what happens, where's your plan B? You know, what happens if you don't get those people into the area? And the answer that, you know, as a layman I would come up with is quite simply, it will need a greater use of artificial intelligence. And I think that's, combined with screening, is the ultimate answer to the sort of package of the health service, I'll put it that way, as regards primary care. Also as an interim measure, there's much more, I think, system where a GP sits rather like a spider at the centre of a web with other professionals all round them, so that you don't automatically route into the GP. Two things that does. It makes the GP's work more interesting, frankly, I would think, than writing out, you know, prescriptions all day long for the ordinary coughs, colds, or whatever it may be. And secondly, it offers some career development to some of the support staff, which I think, you know, that I think would be an interesting model to do. I know this has been thought about quite a bit, but I think it needs really a lot more work on it, because I think we mustn't assume that the charge to get more doctors, if you like, the GPs into the area, is going to be successful. I think you've got to have a plan B for when it isn't. The second thing is I was going to touch on, and Jackie's rather mentioned this, is the question of discharges. I think that there has to be this smooth discharge, because I think if we don't work together, there's always this feeling that I suppose on one side that the hospital can't wait to dump these people out because that's what the government's telling them to do, effectively. And doubtless from the hospital, they say, well, the council probably doesn't want to take these on because it hasn't got the money. Both statements are true, you know, to a certain extent. But it means really that touches really onto something which is going to bedevil the plan quite a bit. And that is quite simply this, that there has in the past, I think, in the recent past, 3-4 years, been a terrific focus on children's services. And as a result, you have, all over the country, local authorities that are focusing too much of a percentage, if you like, and I'll explain what I mean there before you all throw your hands up in horror and say, you're telling me not to look after children, because I'm not. But basically what's happening is that, that because they're not getting funding from central sources, then more and more the agenda is being dictated by children's services. Now I think in that, adult services, they haven't suffered yet, but they are suffering. You know, they can't do the things they want, all the things they want to do. And it's something which has to be recognised, both in terms of, again, lobbying potential, but also in terms of the fact that you know, with ageing and so on, this is going to be a much, much bigger point of work. Potentially, you look after a person longer as an adult service, certainly, than ever you do through their education system, although both are equally important. And I think that you know, we need to understand each other on this, because it is a very difficult problem that we both face. And if we simply, if at the lowest level we kind of dump things into each other's baskets, that doesn't help. It just creates tension between the services and dissatisfaction with the patients. So I'm pleased to see that is being addressed, but I do share Jackie's concern about that. The other things, I think, firstly, I'm very pleased to see that there's more research being done on lower income groups and so on. I think that is getting the focus of the service right. I think that one of the things which I would like to feel that we work out soon, rather than later, maybe over the next 2 or 3 years, is actually what is the role of Medway Maritime Hospital? You know, how do we see it within the overall? Because I think every time there's a thing, you know, for example, where we're going to have stroke services was a classic, but there are all others as well. And what we ought really be saying within in the plans, in a sense, is, well, where do we see the hospital? What services can it best deliver? And I think that, you know, how does that work with, you know, a system where you screen, where you're doing more at home, and where you're actually, you know, investing in artificial intelligence? How much longer, you know, how do you see that? Because what I see is obviously people remaining less time in hospital, so therefore you've got a bigger throughput of beds potentially. It may be that there are other things which plan is very good that will be delivered from healthy living centres rather than from hospitals. Therefore, I think someone needs to look at what's left, if you like, to put it that way, after you've done all this, and say, look, what is the role of the hospital? Because otherwise, I think you end up, certainly if you're on the hospital board, which I'm not, but I think they must feel they're sort of death by 1,000 cuts almost, if you understand what I mean. I don't mean that unkindly, but if you don't see your role, if you don't see it clearly, and no one, a role that's agreed right across the piece, then I think there is that sort of feeling about the whole thing. And I think that leads possibly to some less than perfect decision-making. The other thing which I wondered about was the interaction with first responders as well, which obviously is actually quite important, because we've seen, haven't we, in some cases, and I must admit I'm only media affected here, and I know they're highly selective in what they show, but I've no first-hand experience of this, but the idea that ambulance services dash out there and then come back and then you can't get admitted to hospital at the end of it, and this sort of thing. But equally, there are some very good things now coming out, like the new first responders service, where you actually deal with conditions, much more thoroughly than just sending the car with somebody who knows what they're doing. They've actually got quite a bit of equipment, and they can deal with it. And that might be something which needs more exploration within the plan. Because I think that if you had a higher standard of stuff that can be dealt with on site, then maybe after that, they may even go straight home and never go to hospital. So these are the sort of things which I don't want to extend this plan to the point where it means nothing because it's too big. The other things which I might be, and I won't carry on too long, but the question I think we've got to ask ourselves really is also on this question of what I would call dumping. I think that there is an awful tendency, because of the location of Medway, for councils within the London area in particular to, shall we say, lose people who need a lot of support. And the reason they do that is arguably because if they have to rent accommodation for them, then it's cheaper in Medway than it is in Kensington, if I put it bluntly. But that means that we are actually subsidising. We're only resourced by our population. But if you've got this hidden population that is coming in and doing that and demanding those services, then actually, although you may get some compensation, which you do get a bit, but it doesn't cover their long-term provision, and that strains the service, as David will know, quite severely. So it's a question of how that is addressed and how we can get some recognition, particularly at ministry level, that this is going on, and that it actually, I don't mind if it goes on up to a point, providing it's resourced properly. And providing that there's reasonable grounds for putting people into Medway. Because if you think what it means that someone, for example, if I take the legendary Kensington or Westminster, you're taking them away from their total environment just in order to make the service a bit cheaper. And that's a very cruel thing to do. So I think, I think that's a very, very difficult model, and one which people we found in the past, people find very difficult to live with. You're suddenly sort of parachuted into something that, an area you don't understand with people you don't know, etc., etc. I think that's a very shameful blot on the whole system, really. So I think this overall plan is very good. I hope that perhaps we could look at some of these things. If I can comment too on the healthy living centres, and then I'll be quiet. I think it's obviously healthy living centres have been blamed because they don't work, as much as they should be. But can I, as the person who was mainly responsible, because I chaired the partnership board, for building these healthy living centres, those were actually specified by the NHS on the provision, really, that they expected doctors to do more hands-on doctoring, if they're even performing minor operations there and that sort of thing. When it came to it, that never happened. And I think that's why you've got this concept that it's a very expensive space. But I think, fortunately, now we're beginning to recover by using them better. But again, we've got to actually work out where that break comes, where you can actually deliver services in those healthy living centres, right where people need them. Then they're very good. Or do they have to go to hospital? And if they don't go to hospital, then why does the hospital need to be that size? So those are the sort of questions I'm just thinking about. I'm sorry if that goes across the board.
Thank you, Howard. Jane, would you like to come in on this, please?
Yeah, if I could give Councillor Doe some assurance, really. Just as the Chief Exec of Medway FT, I am really absolutely clear that we are a partner, and we're a partner at the table. And we're part of this health and care partnership. We want to be very much in the forefront alongside our partners about how we can do things differently. If I'm honest, I've just talked about our clinical strategy, and I think that will pick up some of the things that you've just talked about how we do things differently. We've got to modernise and be able to not take everything that needs to come onto the Medway site. We need to utilise and work with others so that if we can use some of the healthy living centres, we will. But there are other opportunities because we are, as you know, a very busy hospital. We have a lot of services on site. And actually part of this work that we're doing at the moment will help us really understand what we're about and how we can contribute to the population and what we can do to meet the needs. So I'm really clear that we're right at the table and we need to do things differently, and that's what we're up for. So I think that's really quite important. And I think the vehicle, part of this strategy, will help us do that through that vehicle. And certainly then, as a health and care partnership across Medway and Swale, we'll be able to respond in a more appropriate and more effective way. But I just wanted to sort of make sure that we give you some assurance. We're not ignoring it, and certainly around some of the services that we have. We've got some excellent services. There's others that we need to work through.
That.
Or perhaps if, did you want to add anything to that at this point, Vincent?
Thanks very much, and again, thank you, Councillor Doe. I mean, I just wanted to add a couple of things really here around the role that NHS Kent and Medway, the Integrated Care Board, has, particularly around that element around leadership and innovation as well. So you quite rightly raised the point around actually we've got a lot of demand for, and I'm going to say primary care services because it's not just around GPs, and actually what can we do differently and how can we use the opportunities that digital or IM&T or provide, or telephony even provide. And I think that's a really important point. And again, within this strategy, we're trying to highlight that through Chapter 8 around how we will do things differently, how we will build on that, but also how will we create a kind of an improvement culture that shares the learning across the Kent and Medway system. And again, you know, it may be that there are changes that will happen around where services are located, but actually what we want to do is improve access and improve access through multiple channels. And again, some of the investment that we'll want to make is in how we can ensure that that digital element really is embraced and that we're thinking about how we invest in that over a period of time. And that's why this plan is very much thinking around how do we move to planning on a 5-year basis so that we're not just changing direction on an annual basis, but we're actually investing in things that we can see developed and flourished over a longer period of time. So I really wanted to echo that point because I think, you know, it's really important that we're working together on this. We're all sometimes frustrated around the changes in direction or reconfigurations that we see that are not in our direct control. But actually, this plan is a plan for Kent and Medway and really focuses on the things that we want to do in Kent and Medway together. And so really just encouraging us to think about where are the opportunities, where else could we drive the plan alongside the local health and wellbeing strategy to really help deliver for the Medway population.
Also, the idea, if I might just say that for you know, for housing in terms of you know, as a tool for key worker housing, if you like. And I just wonder whether we're looking at that in quite the larger role that we should, looking at our estates, where they might go, where we already own land, particularly, or where we can repurpose land. And I think that is something which would be worth a lot of study, I think, by a dedicated group.
Thanks, Chair. There'll be two things. So one is we're going to actually, as the part two of our session here, look at some of those broader issues. So I want to keep that powder dry just a little bit, but just reassurance. I think Vincent's already referenced that we've got the Integrated Care Board and various subcommittees of that board that are picking up various themes. Under the inequalities one, I should know this because that's one I chair, we have got an element where we are linking into housing colleagues to actually broaden that out. So that assurance again is that the issue's been noted and thought through, but because of, as we know, the complexity of how we plan now for the future, there's quite a lot of legwork that needs to be done, and clearly we've already got, as we know, we're not just talking about the NHS estate. I think that's really fundamental. I think we've got to think about all of the assets that we've got in our system and how best we can utilise them. And I know already Councillor Dubb, particularly with the libraries and our other spaces within Medway, we're already starting to look at that as a strategy. And you know that you've got a team of people within our authority that are looking at how we do that joint working. But just that assurance again is that it is noted and we have got an action plan to pick that up and make sure that it's systemised across the way we do things around here. The other thing is, remember, we've got an annual refresh of this particular plan, but we've also now at this moment in time, which is why I don't want to go into in too much detail because David's going to give a bit of a brief on it shortly, our joint local health and wellbeing strategy, which again will aim to prioritise some of those local issues that will then feed up into the broader system.
Well, thank you everyone for your contributions this afternoon. I think it's quite timely that this particular item comes onto the agenda, which is basically the very last Health and Wellbeing Board of this 4-year cycle. Because with the local elections coming up, we'll then be moving into another year, another era, and other things may happen. Forgive me saying this, but I've been involved with the Health and Wellbeing Board of Medway Health and Wellbeing Board and the start-up of Health and Wellbeing Boards when it was first introduced. And in fact, local authorities came into this at the direction of the government. It was the government who said local authorities, upper-tier authorities, will have an input into health and well-being of their community and the wider community that they serve. And I'd like to feel that here in Medway we've done our absolute utmost to make sure that we have done what is right for the people of Medway. During the pandemic, we were in fact linked together with Kent, but it wasn't the pandemic that brought us together as a joint organisation. It was in fact STP. Now, I'm sure we all remember STP. Lots of ideas, full of vigour, all the sort of things that were going to happen. The number of times I've sat round tables at a hotel in the bottom of Bluebell Hill, where everybody had their contribution from across Medway and indeed Kent, where and here we looked at north, south, east, west, and Medway put in the middle. And all sorts of things came out of those meetings and discussions, and where we were moving forward. And when the group had completed their work on STP, we were summoned to a meeting in London. Forgive me giving people a history lesson, but I think it is important that we understand where we are today. Because when we attended that meeting in London, which was chaired by people from NHS England, Kent and Medway were in fact patted on the back because in fact we were the best representation that the board had seen when it came to involvement from local authorities. Because both Kent and Medway were there in force, we were there in strength, because we were all united with what was happening across the whole of Kent and Medway with regard to NHS and our services. We made it very clear that we all wanted to work together. But I remember very clearly it was pointed out what is important is that people listen. And that means listening to what the people within the communities have to say. And believe me, the number of times I've attended meetings where people in NHS have felt that they were the voice of the people. And quite frequently, local elected members, such as myself, such as Councillor Doe and Adrian Galvin and others, we were there to represent the people of Medway. We were there to put a point across the various points. But the whole idea was that people would listen to what the health and wellbeing boards had to say. They would listen to what overview and scrutiny would say. They would listen to the people of Medway. And I've got to be honest and say that I feel that there's been many occasions where we've been totally ignored, totally neglected, and NHS have gone off and done their programme rather than continuing to listen to the people of Kent and Medway. A couple of such examples. One has already been mentioned this afternoon, and that is the stroke services. Interestingly enough, those that were responsible for the change in stroke services are no longer around us in NHS. They've disappeared. Other jobs, other places, other interests in what goes on. What have you done? What have they done? They have left us here in Medway with effectively a service that still needs to be put right. We are the people of Medway. We are the people who said at the very beginning, stroke services, there should be a centre of excellence here in Medway. Because the organisation that were putting that forward didn't get the answer that they wanted, what did they do? They went back to the drawing board. They reconfigured the consultation, and we finished up with a centre of excellence being taken away from the Medway area and put into North Kent. Reason for doing that? Oh, it was closer to London. It would provide a service to the people in London. Nothing at all to do with the people of Medway. So our nearest point of contact for anybody with stroke is in fact Ashford. So we feel still very aggrieved here in Medway that such a calamity should in fact occur. And this is something that, as Adrian said, knocking on the doors, listening to what people have to say. Believe me, if you were wearing a blue, a red or a yellow tie or headscarf representing the local authority, these were the issues that would be pointed at you. But it's not. They're being pointed at us. People in our community look to us to take the lead and to make the points relative to our community. And that's what I've always believed the health and wellbeing was here to do. But our points, our views were totally ignored, and we found stroke services disappear. The latest, of course, is mental health. We've seen mental health services taken practically all away from Medway. Anybody wanting severe support has to go down to Maidstone. And here we were creating, at the very beginning, this feeling of, well, if you're in Medway, you're part of the community. If you've got a member of the family who is in need of hospital treatment or is in need of mental health treatment, it's available here in Medway. Now, we find that's no longer available. People have to go to Maidstone or they go to Dartford. The very organisation, KMPT, who picked all of that up, and again, because they didn't get the answers they wanted, they reconfigured the consultation. I know, I was there. I listened to the people, the community of Medway. I listened to the moans and groans and felt that we'd been sold down the river. I listened, as they did, to the promises made by KMPT. Don't worry, the people of Medway. If you've got a family member in any one of these outlying facilities, don't worry, we will lay on a bus service for you. Well, the fact is, all these years down the road, people of Medway are still waiting for those services. And they look at me and they say, please don't hold your breath, Councillor Brake. We know as well as you do this will never happen. Now, I'm saying all of this because I think it's important that all of this work was going on while we were doing STP, while we've been doing the work around the report that we have here today. And I welcome this report, but I do believe there are certain services that we collectively have lost from Medway, and we need to perhaps revisit those services to make sure that they are in the right place. Thank you. Thank you, Vince, for presenting this report this afternoon. It contains some excellent work, and I'd like to feel that we can move forward. But I sit here thinking, well, how long is it? You say it's going to be refreshed every year. But how many other refreshes are there going to be between now and next year? And other services are going to go to the winds. Please listen to the Health and Wellbeing Board, listen to the Overview and Scrutiny Committee, listen to the community of Medway, and make sure that you're doing what's right for them, as well as the rest of Kent, please. Thank you. I'm now going to turn to our Vice Chairman, please, to sum that up. Thank you.
In doing so, we've raised a number of comments from the committee, and I think that that's something which I saw notes being taken of, and I think that those points need to be included, just as ones that have been raised. Thank you very much.
Is that agreed, please? Yep. Thank you very much. The next item on the agenda is the work programme, to be found from pages 97 to 100, please.
I don't actually have much to add, Chairman, but just to highlight that there are a number of items with dates to be determined, and just to reassure the board that I am currently working with officers to identify appropriate dates for them to be taken in upcoming meetings.
Thank you, Stephanie. The report titles that we've been looking at are in fact included in Appendix 1 on page 99. And as you can see, that as Stephanie has said, there's dates to be confirmed, which we must obviously take note of as we progress into the next cycle. Are we agreed to accept the work programme?
Note that there are a number of items still to be included from the list.
Thank you. Are we agreed, please? Okay. That really concludes the formal business of the Health and Wellbeing Board for today and for this cycle. Thank you all very much, and thank you for your time.
Thanks, Chair. But before we all...